In our second lockdown as a nation at the moment, it is a bittersweet moment. When I say bittersweet, I mean it's a relief that we are actually taking actions towards ensuring that our most vulnerable can stay safe. Obviously, it's quite sad because personally I can't go to the gym. I know a lot of people are struggling with their jobs and it's very difficult. As a service at the moment with the St. Luke's and Marie Curie End of Life Urgent Care Service, we're seeing a massive uptick in more acute patients. So we're talking about a lot of complex situations which need complex handling. One of the statistics I remember when lockdown first happened was within the first 3 months, so the first 90 days of lockdown and this pandemic actually going into full force, we had something like 93 deaths. That equates to more than a death a day. We would go in one day and then the next day you would have empty boards, meaning we had no patients to see, and then within that afternoon it'd be full again. And what we're seeing is obviously a high turnover, which sounds really horrible, but this is the fact. We're seeing a lot of more death, which will be distressing and tiring for any person. We're quite good at dealing with death, like we said. We're very good at supporting our patients and their families, and we're applying these almost methods within our own team, so we're looking after each other. It's worked fantastically. Some of our staff members have made tremendous efforts in looking after themselves and their families. We have people who have left their families during lockdown number 1. We've had people who've got elderly parents they can't see, and still we come in with a smile, we get the job done. And that's because, again, the expertise we provide as a service is not only the patients and the families, it's ourselves too. One of the major differences we have at the moment we've been dealing with is obviously the PPE we're wearing. So obviously we've got the masks on and we've got visors and eye protection now, which will be obviously very detaching sometimes, because you're not seeing Archie or any other healthcare professional, you're seeing a mysterious person in there with this PPE covering half his face. We've gotten quite good at saying what we're feeling, so we will say to them underneath the mask we're smiling. Obviously we're not allowed to touch family members or anything like that. We're big huggers in our team, and obviously one of the aspects of supporting someone is a hug. It's one of the most basic human signs that you're there for them. We can't do that now, so we try and word everything what we're doing, so we're very more animated, using our hands and saying, you know, I would hug you at this moment but I really can't. And it's just trying to adapt. The fact is, end of the day, the NHS is still there, your doctors are still there, they have a job to do, you've got to get yourself checked out. The amount of pressure we're going through now with the pandemic is significant, but it's going to be nothing compared to what we're going to see next year if people don't go see their doctor. Basically, we're having a massive uptick of people with it's called a secondary wave, and it's an uptick in people who have got conditions and not being seen and not being treated, and that could be actually quite lethal and fatal towards them. So obviously see a doctor if you've got symptoms. We're still here. All healthcare professionals are still working, and it's not something to be scared of. We're more prepared now. We know better what we're dealing with. So throughout the year, we have been living with it, working with it, and we have come to understand it a lot better. And it's a very difficult time. We're all pulling out the stops, but we are very good at looking after each other. So, you know, the service is still going to be there. We're still looking after people, and we're still doing what we're doing, which is a good job.